All right. Thank you so much, everyone, for being here and joining us today. My name is Lauren. I'm one of the educators here at Iris. I'm joined by Corey. He is also an educator here at Iris, so you may have seen us when your program first went live or when you received your initial training, or in other webinars or videos. We're all around. So we're glad to be joining you all for another session. This webinar is part of our ongoing efforts to provide support for our clients. We know you have a lot of things going on in your day to day, and it can be challenging sometimes, especially if you take a vacation, go on leave, maybe don't do exams for a little while. It's really helpful to have some refresher, training and refresher, reminders on best practices. So a couple of housekeeping announcements. Everyone is on mute, but if you have a question, we do want you to feel free to ask that. There is a Q&A box at the bottom of the screen. So if you have a question at any time during the webinar, feel free to put that in the Q&A box. We can answer those as we go. We'll also have some time at the end of the session dedicated for question and answer. So you will be on mute. But we do have that Q&A box for anyone who has questions throughout the session. All right, so actually we have a question that's about what we're about to talk about. So this webinar is being recorded. If you have to hop off, or if you have maybe a fellow coworker who wanted to join and couldn't, we record all of our webinars. We include links to those webinars in the next newsletter, sometimes the next few newsletters. So this recording will definitely be included in the April newsletter. We also have all of our webinars on the Iris webinar playlist on our YouTube channel, which is also linked from our newsletter. So if you ever miss a webinar, obviously you're here today, but if there's ever been one in the past you may have missed, or upcoming webinars, we do record those, so you're able to review it at any time. So the last thing I just want to highlight, this session is not meant to replace any training. So if you are a brand new user, if you have not performed patient exams, if you have not watched the Iris University videos, if you've not been onboarded by your manager and your staff members, this training is definitely going to give you a little bit of a taste of what's to come, but it's not meant to replace that training. So you're still going to want to be added to the Iris portal, watch those videos, and receive the internal training from your staff members so that you're well prepared to perform the exam. So this is kind of just a refresher. We're going to go over several different cameras. So not all of this will apply to all of the attendees, but I just want to highlight that this is not meant to replace any internal training. This is just supplemental knowledge for those of you who have already been trained. Okay, anything I missed there?
Okay, great. Next, we're going to start with a poll. We want to poll and see what cameras you all are using. So if you don't mind, we're going to launch this right now. Please put in there which camera you're currently using. Kicking the poll off.
And we're going to put a picture on the screen so you can see the various cameras. So if you have forgotten which kind of camera your organization has, there we go. We have a list here. So you can see the names and the corresponding pictures if you're not quite sure which camera you all are using. So we're just going to give a few moments for everyone to answer. Okay. Looks like we've received answers from almost everyone. So we're going to go ahead and close that poll down here in just a moment. All right, and not surprisingly, we've got a lot of users who are using the Remedio camera. That's the camera with the iPhone. Definitely a pretty widely used device in our clinics, so not surprised to see a lot of people using that camera. Next, we've got the handheld users. So that encompasses a couple of different models where you dock the camera and you upload the images. So we'll definitely cover those two cameras. We've got a few different types of tabletops. We're going to be doing a demonstration on the tabletop that the most users selected. That's the DRS. But we will kind of talk about best practices for the other cameras. The nice thing about tabletops is you're going to see the kind of there's a lot of things that apply to all of the cameras. So even though your workflow may be a little different, your camera may look a little different, the things we're going to talk about are going to apply no matter what kind of tabletop you're using. So good stuff. So we're going to go ahead and exit the presentation. And now you can see us. So the first camera that we're going to review is the DRS. So that's the tabletop camera that's behind us. And so we just want to talk about some best practices. One thing that's really, really important to remember with any camera is your positioning and the patient's positioning make a big difference during the exam. And that is particularly true in terms of patient positioning for the DRS camera. If your patient is not positioned correctly in any tabletop device, you are much less likely to capture high quality images. And so we're going to talk a lot about the patient positioning. The nice thing about these cameras is, once the exam's in progress, it kind of does the work for you. So that's one of the differences between that and the handheld. So my joke is, the hardest part of doing exams with these devices is making sure your patient is properly positioned. So Corey's going to turn the camera around and we're going to talk a little bit about kind of getting started with the exam with these devices. So first thing, it is extremely important to make sure that your lens is protected. Your lens is facing the patient on these devices. So most of these devices have a lens cap. If you have the DRS Plus, where it's kind of slanted, you can see it in the back corner over here, it's kind of slanted up. That lens is protected automatically because it goes up behind those goggles, the little headrest that your patients are positioned in. But the remaining tabletop cameras, you should have a lens cap that Corey's removed and placed on top of the camera. So you want to make sure that that lens cap is on the camera at all times when it's not in use. And then like Corey just did, we want to put it on top of the camera so that we know where it is and we can replace it when we're done with the exam.
One other aspect with this camera is the camera does not have very much protection other than the lens cap. It's very close to the patient. So I always like to tell you, you need to check this lens often with a flashlight. You should have a flashlight handy because you need to make sure your lens is clean, free of dust, free of smudges, because that can impact image quality. So when you're submitting an image that has a big smudge on it, the grader is going to be able to say, I don't see all the anatomy because of the view is impacted. So I always like to, especially if you have a lens cap, I have seen quite a few lens cap photos, and that's because they forget to take that off. And then surprisingly, they get submitted. We don't want those. So if you literally take your flashlight, you can see the lens cap, you got to remove it, but it also gives you a few seconds to check that lens to make sure it's clean and ready to use. Right?
Absolutely.
Now, the next thing we're going to go over is talking about positioning. Now, this is going to kind of fall under the same things for the DRS and the Aiden cameras for those users. The DRS Plus and the handhelds are going to be a little different, but we'll speak of those as we go. So with this camera and the Aiden, they like to have 2 points of contact. The camera wants a flat face, so we need both points to be touched, so meaning the chin rest, we need your chin all the way forward, all the way as far forward as you can go, pressing down, because this camera has an activator switch when you press your chin down. And then the next thing, you need your forehead touching. So Lauren, how do you like to stand whenever you're trying to get a patient set up?
Yeah, absolutely. So we'll twist the camera. And what I see a lot with camera operators when they're looking at their patients, because we perform the exam at the screen, they kind of tend to stand here for the entire exam. When I'm evaluating my patient's positioning and I'm explaining to them, I actually like to come over to the side, doesn't matter which side, but here I can make sure that my patient is achieving those 2 points of contact. I can also evaluate how their back is positioned, whether their forehead's touching the bar, whether they look like they're comfortable. So from here, it can look like your patient is touching, but they're actually not making contact with that bar, and it's a lot harder to see from this vantage point. So I can tell that Corey's forehead is at the bar, but I can't tell whether or not it's touching. And if I come to the side, I can see very clearly Corey has created a gap. Now, another thing I see here is this is actually a little bit low for Corey. So if Corey were to sit back in his chair, We don't want the forehead bar to be lined up with the patient's forehead, but we want it to be about eye level. So this table is actually just a smidge low for Corey. I'm going to bring it up just slightly because we want the patient to be able to come forward and slightly down. So now I see Corey's still able to make those points of contact, but his shoulders aren't hunched over the way they were earlier. Your patient can place their hands on the table like Corey does. You can also place them, they can place them in their lap. They can even reach up and touch the sides right here if that's comfortable for them, if that helps them. We don't want them to like pull on that, right? We don't want them to bring the camera down. But they can, if they want to just rest their hands there. Most patients, they're going to place them on the table because that's what feels comfortable. So I know that it seems like, making sure the patient's comfortable, it doesn't seem like it would be that important. But if your patient is not comfortable during the exam, they are a lot more likely to move. And if they move during the exam, that's going to impact your image quality. So we want the patient to be comfortable because we care, but also because it's going to help us achieve those better images because they're not moving around. A lot of times what I see is people are inclined to keep the table higher than it needs to be. So when you see the patients having trouble bringing their forehead to the forehead bar, a lot of times I see that people want to raise the table, right? Because they think, oh, I just need to line that bar up. But what actually happens is that makes it harder for the patient to get there. So when you lower the table, their forehead comes forward toward the bar. You can also raise and lower the chin rest. So on the screen for the DRS and on the other devices as well, there's an option to raise and lower the chin rest. So you can also play with that. Sometimes it's not really the table that needs to be adjusted. It's the chin rest because of the size of the patient's face. So it takes a few moments to get the patient situated, but you'll make up for that on the back end because of the way the camera takes photos. So I'm going to let Corey sit back. Do you want to raise your chair back up or are you good? Okay. And I'm going to go ahead and demonstrate image capture. So again, a clear explanation to the patient, helping them understand what their job is during the exam. Like Corey said, we want them to understand their chin needs to be on the chin rest, pressing down. And you can even specify on this device, press down till you hear the click. And so that allows not only for them to be securely positioned, but also for us to start the exam. Because if they're not pushing down until we hear the click, we can't take the photos. And then again, helping them understand that forehead should be against the bar. We didn't specify this, but I do want to take just a moment to highlight, we should sanitize these touch points, these points of contact prior to the exam. So what I will normally do is as I'm explaining the exam to the patient, I'm going to take an alcohol prep pad. I'm going to rub that chin rest and that forehead rest. I'm going to do that in front of the patient so they know it's been done. And so I know it's been done. And that'll ensure that those points of contact are sanitary before we begin positioning the patient. Last thing we want to do before the exam begins is we want to tell the patient what their job is. So in addition to being positioned properly, they need to be looking at the internal light inside the camera. So all of these devices have a light, or in the case of the Aiden, I believe it's an X that they have to look at. And so you want to make sure that the patient is looking where they're supposed to be looking during the exam. And so again, that should be part of our explanation, because if they're not looking at that light, then their anatomy is not going to be in the correct location. All right, last thing I want to touch on real quick. For those of you that have this camera, the DRS Plus, the one that's angled, the way that it's helpful to talk to the patient about positioning is helping them to understand they should wear that headrest as a pair of goggles. So that big piece should be on the forehead, and then the curvature should rest right along their cheekbones. And so if you tell them to wear it like a pair of goggles, that's usually a little more intuitive for them in terms of their positioning, because they're just coming forward and down. They're not having to maneuver the way that we are with these other tabletop devices.
You gotta restart that.
Yes.
She's gonna get the camera set up. So a couple of things that I do see sometimes is the chin rest. There's people who like to hover over the chin rest. Remember, it's an activating button. You can't start the exam without having that depressed. So we do want to make sure they hear the click and make sure they are doing it, and with their chin forward. Now with the DRS Plus, you may have to adjust their eyes up and down just slightly to put them in that sweet spot so the camera can find their eyes. And we'll go over one other tip for this camera for the DRSs that a lot of you don't know, and we'll go over that. It's part of lens cleaning, the red light. Great class. You ready?
All right, so Corey's positioned properly. We've ensured that his chin is touching so that I hear the click. I know his forehead is pressed against the bar. And so now when I switch the camera view, we can watch image capture in real time. So I'm gonna go ahead and hit that start button. All of the tabletop devices are gonna tell us how big the patient's pupils are. All right. It was just gonna let me do it from. Took me to the work list. Here we go. All right. So all of these tabletop cameras are going to tell us how big the patient's pupils are. Go ahead and push down. And so when we begin the image capture process, it's very important that we are looking at that information. So on some of the cameras, it's going to be on the side. On the DRS, it's going to be right here next to pupil. Anything 2.8 and above is going to give me a high quality image. So I'm looking at that pupil size to ensure it's above 2.8. If it's not, I'm going to hit that cancel button. Corey's pupils were above 2.8. It'll still sometimes give you a small pupil indicator if it's less than 3.8, but that's okay. And so now we can see that image preview. The camera should have a delay between images. Please do not bypass that delay. I know it seems like it's an eternity waiting 10, 15, 20 seconds, but this allows their other eye to dilate again. So we flash the light in their eyes. We want their eyes to recover. So especially if you're noticing those left eye images, the pupil's smaller, if you're bypassing that delay, you're not giving that eye time to recover. So we really want to let that delay go through so those eyes have a chance to recover and redilate. Camera's moving over to the left eye. And again, I'm looking at that pupil size. And again, if I don't see 2.8 or above, I'm going to cancel. And I'm going to let Corey's eyes dilate a little bit longer. Now, his pupils were nice and big for both images. I'm not at all concerned about image quality here because I know that his pupils were well above that 2.8 threshold. And so now we have these beautiful images, just like with any device. All of your cameras, no matter if the camera took the photo or if you took the photo manually, you need to evaluate that image for quality. We have got to ensure that these photos are as high quality as possible so that they're likely to be graded. So we want to see the 4 parts of anatomy, those blood vessels up top and below. We want to see that optic nerve and we want to see the macula. We want to make sure that those parts of anatomy are in the correct location and that they are clear and in focus. If this photo does not satisfy one or more of those requirements, it's less likely to be gradable. So every single time you take a photo, no matter what machine you're using, you've got to evaluate it for quality. All right.
One last thing though, I do want to point out, and this is for the DRS camera specifically, is there are some additional things when you are cleaning a lens. If you see there are red lenses below and on the sides of the actual lens, this is what helps the computer find the eye, measure the pupil, and do all the work that you needed. So we do, if you ever deep clean the regular lens, I want you to clean the red glass with that. Just use the wet wipe, you don't have to dry it. Just use a wet wipe on that glass because we're cleaning that because that can get stuff on it. As people trap their face and start trying to talk to you, sometimes they spit on accident. It's going to hit some of this, and this can affect where the camera has a struggles to find your eye.
Absolutely. So if you ever notice your camera's acting a little wonky or it's having difficulty finding the patient, like Corey said, you can take that flashlight, shine it on those sensors. The other thing I always like to talk about with tabletop cameras, it's very important to periodically turn the camera off. So just like our cell phones or our regular computers, if you leave a machine turned on for a really extended period of time, it's going to start to mess with how that machine operates. So you don't have to turn it off every day. Definitely don't turn it off between exams, but usually what we recommend is once a week. If you're closed on the weekends, turn the machine off on Friday afternoon before you leave the office, turn it back on Monday morning when you re-enter, and it should be good all week. But having a regular workflow of turning that camera off is really beneficial to helping keeping everything run smoothly. All right. So I have a question on getting a flashlight. So Iris does provide a flashlight when your camera is first given to you. A lot of times, especially if your program's been live for a long time, that flashlight gets misplaced or, maybe accidentally goes home with someone. Any flashlight will do. You can buy one. We get ours on Amazon in bulk. You can honestly just use the flashlight on your cell phone.
Yeah.
Doesn't have to be a fancy, like there's no special kind of flashlight. It's just got to be a flashlight.
A
So
$3 one at a drugstore works perfectly fine. I do prefer a regular flashlight because the light is more direct. Where if you're using your smartphone, that is more of a broader light, but it will work for you. I just like a direct flashlight because it gives you a hot spot right in the middle and it makes it easier, a little bit easier to focus on. But again, a $3 flashlight, all it takes. You
Yep.
know, you're not as worried about that walking away, and it's just a $3. You can buy, a couple of them and just have them around the camera at all times.
absolutely. So any supplies that you need like for cleaning the lens or alcohol prep pads, anything like that, once you've run out of that kind of initial, box that we provide, just from your medical supplier, you can purchase those items. Doesn't have to be the same brand as long as it's a comparable item. So, when we send out the wet lens wipes, we send out, this brand. You don't have to get this brand as long as it's a wet lens wipe that's designed for cleaning glasses and lenses. That's fine. So, and if you ever have any questions about that, you can always reach out to our help desk. All right, we've got one more question. It's kind of specific to the clinic. So if we don't answer your question live, if it's more specific to your device or your workflow, we'll follow up on those questions later. So I do see that question and I will be following up with you regarding your device. So again, if you have questions throughout the webinar, feel free to put them in the Q&A box and we'll keep on answering them. The next device that we want to talk about is the handheld device. So this is going to be, we're going to be using the Volk Pictor Plus. Your device may not look exactly like this. It may be a different kind, a different brand, but the primary points of, taking images are going to be the same. So the settings might be a little different. The workflow might be a little different, but how you take photos and kind of the key points, the essentials are going to be the same for all of these devices. All right, so yeah, we can go ahead and push that out of the way. All right.
All right. So with this handheld, it is a little bit easier to control. It is a very kind of straightforward on a straight up and down type axis. So whenever we are addressing our patient, we're gonna come like more straight in because it doesn't take a lot of movement up and down. I'm right-handed, so I always hold this device in my right hand at all times. Same thing for the other handhelds. I pretty much will hold it dominant. I use two hands. It is a two-handed device, so we're going to create a bridge. We're going to land this. This is going to connect to our patient right on the temple or around the forehead, however you want it. But we're going to create that bridge, and we're going to land this camera right on the tip of my thumb. Now, the way we prefer you to control, even though you're maybe right-handed dominant, or if you're holding your left hand, that's the same thing. We can still do the same things. We're going to control with our non-dominant hand, okay? What I mean by that is we have the ability to raise our thumb up and down. And if we have to pivot any, we're pivoting our hand right and left. That is simply just pivoting my hand right and left. But one thing I do want to note, I'm going to point out like best practices for your hand position, but I do need your thumb, which you're going to land the camera on, as far away from the face as you can possibly go. I know everybody's hand's a little different size, but we need some distance so we are not jamming this right into their eye, right? So for Lauren, I'm gonna have her just slide out and I'm gonna come from this side. Sorry, I'm gonna start with the right eye. Sorry. So right here, I have built my bridge. My thumb is level with the tip of the nose. I do this because every time you land the camera, you will see her eye every time. That is definitely the easiest. Now my thumb's far enough away from her cheek, she can literally put her whole hand in between my thumb and her cheek. The reason I want that is because I need that distance to land the camera, and then I have mobility to slide it forward, okay? Now the next thing is holding the camera in your dominant hand. Any handheld, we always want you to have your elbow as close to your body as possible. You can slide a little bit and then start leaning forward. You can still slide. I don't want you to extend because the more you extend, the more muscles you hit, the heavier this camera can get. Camera doesn't weigh a lot, but after holding it extended time, it can get very heavy real fast. And if it gets heavy, it starts shaking. So next is I'm building this position. I'm kind of right over her left knee or her right knee, and then I have the camera landed, and then when my camera capture screens, I can see everything that I need, and I am just slowly advancing forward to where I need to go. And then I capture my photo, and that first photo was really good. So that is all it really takes. It is just a subtle movement. It does not take a lot of movement. Now, what we can do is I'm gonna take another photo, but I'm gonna try to show you from my capture screen so you can see what I'm doing. So I'm gonna have her turn. Is there anything you want to add right now?
Yeah, so a couple of things, in terms of, patient requirements, we want to make sure that the patient understands you're going to get close to them, you're going to get in their bubble, you're going to touch their forehead. And so, as part of my explanation, I'll let the patient know you're going to feel my touch on your forehead. I'm going to get pretty close to you so I can maneuver the device. And I also do like to highlight, and I do this for the tabletops as well. Letting them know there's not going to be any pain, any discomfort, any puff of air, just a bright flash of light when I take the photos. With the handheld device, you want to make sure for this device that they are covering their other eye because they're going to be focusing on that light inside the camera. So for the tabletop, they don't cover any eyes, but for this handheld device, we want them to cover the eye we're not imaging. There are going to be people who can see that light without covering their eye, but there's a lot of people who can't. And it's a lot easier to just have everyone cover their other eye just to be sure that they're going to be able to very easily see that light inside the device. So we want the patient sitting up. We want them relaxed. We want them to understand you're going to come close to them. Like Corey said, we don't want to reach out our arms, and so we want them to be prepared for all of those things. And then all they have to do is cover that eye and look for the light as you bring the camera toward them.
All right, so we are pretty close to set up. You're gonna get a quick shot of little Lauren here. All right, so I have built my bridge. You can see my thumb. She can stick her whole hand in between my thumb and her cheek, level with the tip of the nose. Because when I land the camera, I can see her eye, right? I'm still far away. So, but that silver part is my target, right? That is where I am heading with this camera. So I'm just slowly, and I'm not super steady, but I'm moving it forward. Now, as I start looking, I'm looking for the optic nerve because that tells me the other anatomy is right. Over on the right-hand side, I see the optic nerve. I see the optic nerve on the right-hand side, so I know my anatomy is correct. And I'm just trying to fill that screen with the brightness of the retina, and then I capture my image. And that is a very nice image. I see all four parts in that, and then I am done with that eye, and then I would, of course, move over to the other one.
So like Corey said, when you land that camera in front of their eye, you're looking at that glowing orb in the center of their eye. So in these devices, it's going to be kind of like a white or a silver kind of circle in the middle of their pupil. That is what tells us how big their pupil is. So when you land that camera, you're going to know right away. Do they have a big pupil? Do they have a small pupil? And like Corey said, that is your target. You want to keep that centered as you advance the camera forward.
So with this camera, with this one, you see the circle of the pupil, but the way this camera is set up, the flash is really at the top and the light of the IR sensor is there as well. So you basically are seeing in that circle, you're going to see on the top that silver, however big it is how big the pupil is. If it looks like a sliver, that is still your target. You're going to the silver part, and that is what is going to illuminate and open up so you can actually take a successful image. But always the top portion is white. Now with this camera, it does have one kind of issue. As I was saying, the flash kind of happens at the top. So the images are inverted. The bottom of the picture is actually the top of the eye. So sometimes you'll get a flash bloom in the bottom. Just you have to, what we do sometimes is say, drop the back, lower the back. So the flash is going to be diffused over part of the eye. Or you have the ability just to raise it up just a little bit more and move so that diffuses that flash over the whole eye. So you'll get a more complete image. Just remember that flash bloom, that very hot white in the bottom is really just the little bit of positioning. You just make a slight adjustment and capture a second image of that. You'll have a complete anatomy of the eye.
If you see a blue bloom at the bottom, that tells you weren't close enough.
Correct.
So if it's like a yellow or like a white hot light at the bottom, then you can make that adjustment. Like Corey said, kind of we call it driving up the hill. You can kind of drive up a little bit into that pupil. But if it's blue, that means we were too far back, and so that means you need to keep advancing. And with these handheld devices, it's really important to remember that if you can see their eye on the screen, that means that eye cup is around their eye, right? So when Corey lands that camera and he sees my eye, he has no like concern because he knows that that soft, squishy eye cup is just going to very gently rest on my face around my eye. So the more that you are looking at that screen and verifying that you can see their eye, you're going to know where they're at all times, right? So just remember, this is not going to be painful, but you don't want to look at the patient because that's actually when you have a greater chance of getting out of alignment with their eye. And so you want to make sure that you're not looking at them. You want to look at the screen. Um, and Corey's showing off his camera skills, taking a photo of his own eye, and it came out pretty good. That's the benefit of practicing with these devices. So one thing I always like to say, especially when I'm onboarding new clients, I didn't come to Iris knowing how to use any of these devices. I learned these cameras the exact same way that we teach them. Someone here at Iris showed me how to use the device, and then I had to practice. And I had to learn kind of all of the little tips and tricks. I had to take photos of other people, lots of other people. I had to do patient exams. And so that is what has helped me become proficient. So when Corey and I make it look very easy, it's not because we're special. It's not because we were given some secret knowledge. We've just practiced a lot. And so that's one of the things we always try to talk about. The more that you use these devices, the more exams that you perform, the more it becomes a working part of your mind. It's just like riding a bike. You get to that point where it's just second nature muscle memory.
Yeah, that's my favorite analogy because it is like riding a bike. You had to learn how to pedal, steer, and balance all at once. The beautiful thing, once you kind of got really comfortable, like you could ride the bike without your handlebars, you could put that bike down for 6 months and pick it right back up and just take off because you built all that muscle memory. But it's all about that practice to get to that point. This becomes so easy and it'll become quicker, more efficient once you start seeing. Because a lot of times we teach you all the big things, but it's all about the little things, the little nuanced stuff that really will hone in your skill and you'll be a master in no time.
Absolutely. So the last camera we're going to talk about is the Remedio device. This is the device that has the iPhone on the back. So there's actually two different versions of this camera. The main version that's primarily in use is the one that has the blinking light inside the camera, just like the handheld we talked about. Corey has the version 1 that has what we call an external fixation. So for the external fixation, that means the patient is going to look at this dot with their other eye. So I just want to talk about that real quick before we dive into the other camera. If you have a Remedio with external fixation, it is really, really important that you have a good understanding of how to maneuver that rod and that you understand that the optic nerve will move right with that dot moving. And Corey just did a trick that we do a lot when we're taking these exams. So that dot glows in the dark. But a lot of times the light within our clinics, or if you're bringing the cameras into homes, right, that dot's not absorbing enough light to really make it stand out in that darkened room. And so you can take a flashlight, again, doesn't have to be a fancy one, and you can shine it directly on that dot. And that really makes it pop out. The other thing you can do to help bring that patient's attention to the light is you can bring the dot out as you're explaining the exam. So once you get to the point where you're telling the patient where to look, you can bring that dot out and you can say, okay, Mr. Patient, I want you to look at this dot and then bring it into the starting position because we want it as close to the camera as possible to start out. But when you tell the patient to look at the dot and it's in that position, sometimes it's hard for them to find it. And so bringing that dot out and kind of calling attention to it before you place it back in that starting position can be really helpful. So we want the rod pointing out to the right-hand side for the patient's right eye because they're going to look at it with their left eye. You want to make sure that rod is parallel to the floor. And then like Corey just did, when you move to the left eye, you're going to move it to the left side, again, parallel to the floor. And you're going to have to switch hands when you're using this device so that the patient can fixate on that external light on that rod. So those are a few of the key differences for that camera. So if you have a camera with external fixation, just remember, switch hands, make sure that that rod is moving because it's really important that your patient can fixate on that since there's no light inside the camera.
Now, the good thing, basically, image capture is going to be the same for this device as well as that. It's just the fixation is really the big difference maker. So we'll pick this one up and we'll take it off.
All right. So a lot of similarities in terms of the patient positioning and in terms of your positioning. One thing that's very important to remember is the angle that you approach the patient is a lot more important. So, like Corey said, with the handheld camera, you can come in a little bit more straight on, and it's not going to impact image quality as much. But when you're using this device, it's really, really important that you come in at an angle so that you're not hitting the bridge of that patient's nose with the eye cup. We want to get a nice seal. It's also a lot easier to isolate that pupil and aim for it when you are approaching them at a bit of an angle. So, just like the other handheld, ideally having the patient sit in a regular chair, have you sit on a rolling stool so you can adjust the height. That way, you can roll right up to them. Just like with the other handheld device, we want to keep the hand that's holding the device in tucked in, that elbow tucked in so that the device is nice and close to our body. We've got good control over the device. And we want to make sure that we are prepared to use this as a two-handed process. So identical to the other handheld, you are going to first reach out and establish that contact with the patient, placing your forefingers on their forehead. And again, you're going to land that camera on your thumb. Now you've got a little bit less runway on this device. You want to land on this hard part. So like Corey said, you can slide that camera over your thumb. You can also do what I call the squinch method. You can squinch your thumb as you're bringing that camera toward the patient's eye so that your thumb is still resting on that hard part of the device. And you want to make sure that that camera is on your thumb, just like with the other handheld. You don't want to put it in the crook of your hand because this thumb has to be prepared to make those adjustments up and down and left and right. So this camera in particular, it's kind of like it's on a seesaw. So we don't want to try to make adjustments with the hand that's holding the device because you're going to make bigger movements and the front of the camera is actually going to go the opposite way of where you're turning the device.
Now, one thing I do want to just touch on, she did mention about like sitting. We prefer that you sit. We are not a fan of standing. Standing can make you a little less stable. So we prefer that you sit because it also brings you to level portion of the eye. Sometimes if you stand, you tend to point the camera down because you're towering over a person who's sitting. So you don't want to point it down because if they have, extended eyelashes or a droopy eyelid, you are going to compound that factor by 10. It's going to be a lot worse for you and it's going to be harder for you to overcome. You want to go to the biggest opening of the eye. You don't want to go to where all the movement is coming from and something that may impact your image quality.
Absolutely. All right. So if you do stand, it can be helpful to go in kind of like a lunge position. Like Corey said, really the point is making sure that this stays parallel with the floor and that you can see the image capture screen. If you are able to, you could also kneel down if your knees will let you. So there's a couple of different ways you can approach, especially if you are one of the operators that's going into homes. You can't always sit down.
Correct.
You're not as in a controlled environment. So knowing how the camera likes to approach that patient is a really key factor in making sure that you are comfortable and that you're also getting the highest quality images possible.
And another thing, like if you do have to stand, you can have your patient lean back a little bit, and then that gives you a little bit easier time to be level with the eye. Because again, if they're facing forward and you're standing above them, you really have to almost get into a lunge position to do that, and that's not very comfortable. So if they are leaning back, they can just tilt their head back a little bit, and that gives you a better position to be more level with the eye. To the biggest opening is what we're always trying to describe.
Absolutely. So just like Corey did earlier, when I place my forefingers on his forehead, I want to make sure my thumb is out from his face at eye level. And again, Corey can place his entire hand between my thumb and his face. And that ensures that when I land the camera on my thumb, I still have a few inches away from his face so that I can see his entire eye in my field of view. So one of the things I see a lot with camera operators is they put their thumb like kind of in a similar position, but their thumb's really far down. If I were to land the camera on my thumb here, I'm going to see Corey's cheek, right? I'm not going to see his eye. So making sure that you're giving yourself that good landing spot.
Good
Your
start.
thumb can be at like the tip of their nose, right? So that way, every single time I land and there's his eye, boom. I don't have to search for it. I don't have to find it. I can see it right away. And you can kind of experiment with your forefinger placement. But with all these handheld devices, you want to make sure your placement is firm so that your hand is really acting as a support. So that one finger feather touch, that's not going to cut it. We want to have a nice firm placement, and you can kind of experiment with what feels, most secure for you. If you're holding the camera in your left hand for the right eye, you're going to place your right hand on the center of their forehead. And then you would just do the opposite, right? So the camera doesn't care what hand you hold it in. If you're left hand dominant and you want to hold it in your left hand, you can absolutely do that. You would just reverse the hand positioning. Again, your comfort is very important when you're taking images with a handheld device. If you're trying to kind of lean, if your arms are stretched out, if you're doing the chicken wing, anything that increases your discomfort is going to reduce your ability to control the device. And it also lessens the likelihood that you're going to capture high quality images. So if the camera's feeling heavy, if it's feeling awkward, evaluate your positioning. How are you holding the device? How far away are you from the patient? Is your elbow jutting out? Are you kind of leaning to the side and you're not really coming at that angle? These are all things that can impact your comfort and also your image quality. All right, so we're going to put it all together. I'm approaching Corey at a bit of an angle. You can use the corner of their chair as a reference point so I get a nice seal and I'm not coming on the bridge of his nose. Hand and then land. Corey's going to cover his other eye and look for that blinking light inside the camera. And I'm looking at the screen as I come in. And once I see all the anatomy, I'm going to take that photo. And so this is the image I just captured. The mirroring turned off. There we go. Okay. All right, so this is the image I just captured, and we can see all 4 parts of anatomy. They are clear and in focus. They are in the correct location. So I feel confident that this image is likely to be gradable. With these cameras in particular, you do get a little bit of feedback. It's really important to remember that that feedback is not the be all end all of gradability. It is possible for quality to say sufficient and the photo to not be gradable, especially if the anatomy is in a wrong position, right? Or so it might be clear and in focus, but it's not in the correct location. So again, it's really, really important to make sure that you are evaluating these images for quality because what the camera says and what you think might be different, and that's okay, right? You are smarter than the camera. These handheld devices, you can take multiple images, like Corey mentioned earlier. You can capture different aspects of the anatomy, so you have a little more leeway in how you upload images, as opposed to the tabletops where we're really just looking for one image per eye. So I'm going to show you this process from the image capture screen. I'm going to go ahead and turn off the lights and get Corey set up. So I'm placing my hand at his temple. I'm landing the camera in front of his eye. Again, I can see his whole eye. This is the view I want to see before I begin moving forward. And I want to line up that plus sign with that glowing orb in the center of his eye. So just like with the handheld devices, that's what I'm aiming for. That's the retina reflecting back through the pupil. And I can see Corey's got a nice big pupil. And so I'm going to advance the camera toward his eye. And I'm going to make sure that I'm centered on that retina. And I want to make sure that I can see that optic nerve on the correct location. So this is his right eye. I want to see that optic nerve on the right-hand side. And I want all the shadows to go away before I tap that button to take the photo. So it's really important that you're looking at that screen, that you're making sure that the retina is filling the screen in its entirety. If you see dark shadows on your image capture screen, and this is true of the handheld as well, you're going to see shadows on your image. So you want to make sure that you're pushing in close enough so that the retina is really filling the screen all the way out to the edges. Just like with the other camera, if you see blue shadows or tan or white shadows, that's an indication we're too far back. So we need to take that photo again, and we need to advance the camera forward. And I'll show that to you right now from the image capture screen. So as I advance forward, I really want to get those shadows to go away. But if I fail to do that, if I stay back here where there's still a lot of shadow on my screen, if I take that photo, we can see very clearly I'm too far back, right? This is not an issue with the patient. This is an issue with my positioning. I didn't come in close enough. I didn't finish driving through that tunnel to the back of the eye where the retina was filling the screen.
And if you see the darkness is always the pupil. That is the part that we are trying to go to the end. The pupil is like a tunnel we always talk about. We're trying to take a picture of the back of the eye. So we have to push the camera through that tunnel to get to the end, to get the end result. So if you have darkness that is due to the pupil and you're just not close enough to the eye, especially if it's very uniformed, then it is not a small pupil, it's just positioning and you didn't go far enough.
Absolutely. So you're going to know it's a small pupil before you ever take a photo, right? When you land that camera in front of their hand with any handheld device, in front of that hand, in front of that eye with any handheld device, you're going to see that target, right? That glowing orb, whether it's the white silvery orb of the other handheld or kind of the purplish orb of this device. That is the patient's retina reflecting back through the pupil. And so you should know before you begin advancing the camera forward, does this patient have a small pupil? Does this patient have a big pupil? And the size of the pupil makes a big difference in how easy it is for you to capture these exams, right? So we all know the smaller the landing pad, the more precise you have to be in your movements. And so we actually have a question about this. Tips for patients whose eyes don't dilate well with natural dilation. So when the pupil is small, what are some tips for taking photos with the handheld camera? So the first tip is make sure that the room's as dark as possible, right? Any sort of ambient light that's coming into that room, if you've got a computer monitor turned on and it's in their field of view and it's in their face, that's going to impact dilation. If you're using those red night lights, right, making sure the red night light's kind of to the side or even behind the patient, because while red light doesn't impact dilation as much as other types of light does, it still does. So making sure that that natural dilation technique is really solid, you're in as dark a room as possible, right? You're going to have patients that don't dilate very well, no matter how dark the room is. You could be in a pitch black, dark room, and some patients, even after 10 minutes, their eyes are going to not be as dilated as we would like. That's just the luck of the draw. That's how it is sometimes. So you have to remember that there's going to be times you have to take pictures of small pupils. One of the things that makes it easier for you to take pictures of small pupils is being comfortable with the camera. So what we kind of joke about is big pupils are a confidence builder, small pupils are a skill builder, right? The more fine-tuned that you are with those movements with the camera, the easier it's going to be for you to take pictures of small pupils. So someone that might be really hard for you to take pictures of when you're first learning the camera and getting comfortable, fast forward a year, you've been doing exams for a while, they come back, suddenly they're a lot easier to take pictures of. And it's not because anything has changed other than your comfort and skill with the camera. Making sure that you're holding that camera really steady. The other thing you can do is you can use the small pupil mode on this particular device. So this is not a feature that's available on the other handheld camera. But if you're on the image capture screen, there's a circle with the word normal. It's in the lower right-hand corner of the screen when the phone is vertical. And if you tap that button, it'll change to small. And so that indicates that the patient has a smaller pupil, and I'd like the camera to recognize that. And so it'll give you a little bit of a boost. So don't be afraid to use small pupil mode on this device if you've got someone with smaller pupils. That really does help a lot in terms of giving you kind of that extra boost. It's not a magic wand, it's not a guarantee, but it does help a lot. And then the last thing with small pupils is remembering you might have to take multiple photos to show different aspects of the anatomy. You might not be able to get those shadows to go away completely because you're dealing with a smaller pupil. And so taking different aspects of the anatomy, capturing different pictures that show different parts so that you can show a comprehensive view of the anatomy is really important because we don't want to send 3 pictures that all show the optic nerve, right? One picture that shows the optic nerve, one picture that shows, the upper arcades and the macula. Like we want to show different aspects of the anatomy when we're sending multiple photos because that helps the interpreting provider have a better chance of seeing what the whole eye looks like.
Now, one thing before we finish up and get to the question and answer, we're going to talk about one other thing that's going to be like dilation. We do have a webinar based on this, but we just have kind of come up with a new policy. So if we actually had a poll, I bet everybody would have a different answer of how long they're going to let somebody dilate in our dark room, correct?
Yep.
So what our preferred new method is, and we have conveyed this sometimes, and of course, again, there is a webinar on this, and this covers all cameras, okay? Not just the handhelds, not just the tabletops. But our preferred method is bringing the patient into the room. And again, if this is how your workflow works, but bring him into the room. We don't prefer that you bring a patient in, tell them you're going to turn out the light and walk out the door and say, we'll come back in 10 or 15 minutes, because that is not a good experience for the patient. They become, uncooperative sometimes. They will play on their phone the whole time, which can always be difficult. So we like to be in the room with the patient. Now, what we'll do is we'll sit them down, say if it's a handheld, we'll sit them down and we're going to tell the patient we're going to turn off the light. If it's a tabletop, we're going to get them set up and then tell them to sit back once we're set up and say, hey, we're going to turn off the light. Or what you can do when you're setting up a tabletop, turn out the light, have the door cracked open. So it's starting to get dim, right? It's kind of dimmer. And then get them set up on the camera and then turn out the light, make it pitch black. Because a lot of patients, their pupils will bloom really fast, but there's others who won't. But this is what allows you to, discuss in the dark. We want you to discuss what you're doing, why you're doing it, and how you're doing it. So what are we doing? Hey, we're just checking your eyes to see if diabetes has affected your eye health. Why are we doing this? Did you know the number one cause of blindness is due to diabetes? We're going to make sure you're safe and no issues, right? If you're having any type of issues, we can get you the help you need. Then how? You describe the exam process. But while you're doing this at the dark time, you are buying dilation time. You are spending time making them more comfortable while you're explaining the whole process, just doing it in the dark. And then what you can do is you can land the camera and see how big the pupil is, or set up, have them say, all right, we're ready, put your chin forward or get down in the goggles and we can get this exam started. Most of the time, there's probably 80% of the time, you could finish this total exam with everything done in less than 5 minutes.
Absolutely.
Very easily. Sometimes faster and sometimes it may take a few more minutes. But if they have a smaller pupil where it's a little more challenging, you can allow that additional dilation time, or if you can administer dilation drops, this would be the time I would do that.
Absolutely.
Now, one thing about dilation drops is I always like, if you have an EMR, I like to make notes. If I did dilation drops last year, I know they're coming in. As soon as they come in the door, go do the dilation drops. They can go see the provider. They can do all these things. And then when they get back to you, you can just take the photos and they're on their way. So you can accelerate things. Don't be afraid of time. This thing does not take a lot of time. It's not like you're locking up a room for 20 minutes. This can be done very, very fast if you just become efficient. And of course, like she said, more skilled with the device. Remember, all movements for handhelds, small movements. The smaller, the better.
Yes, for sure. No, that's good. That's good. So just a reminder, we're coming up on the end of time. We've got about 8 minutes left. If you have questions that you haven't placed in the chat, go ahead and do that now in our Q&A box. We'll try to get to as many questions as possible before we end. One last thing I want to say about, we've talked a lot about image quality. We talked about dilation. Dilation in particular is one of those things, particularly if you are only using natural dilation techniques, there comes a point where you don't really have the ability to make their pupils any bigger, and you've got to capture the best photos you can. That is always our recommendation with any exam. Whatever challenges you face, if it's something you can fix, like a dirty lens, right? That should be pretty straightforward. You clean the lens and then you take the photos. Something like dilation, there comes a point where you can't really do any more than you've already done. And so you just got to take the best photos you can. And it's really important that you do that, because when you take the best photos you can and you show the most anatomy possible, you give that interpreting provider the chance to see whether there's any pathology present. And so our CMO likes to say something is better than nothing. Right? If you cancel that exam, if you don't upload the images and there was eye disease present that the interpreting provider could have identified, then that patient is further delayed, right? They're going to get a generic referral that they may or may not take, right? Because these are patients that are already not accessing this exam for a various number of reasons. So our goal is always to take the best photos we can and then let the interpreting provider be the final decision on whether they're gradable. Because if eye disease is present, they will be able to indicate that. If the exam comes back not gradable, that person still gets a referral, right? So it's still a win, but we've at least given that opportunity for identification. Perfection is not the goal. It's not something that we're trying to strive for 100%. You're not going to get 100%. So it's important to remember that our goal is to take the exams to the best of our ability, right? All right. So we have a question about turning off the tabletop devices. We do recommend that you turn those tabletop devices off periodically. So yes, the question mentions through the weekend. That is our recommendation. If your clinic is closed on the weekend, turn the device off on Friday afternoon, turn it back on Monday morning. If you're not closed, if you're open 7 days a week, pick a day of the week, right? We turn it off, Friday evening, and we turn it back on Saturday morning, or whatever works for you. Just have kind of a regular workflow that everybody knows about, so that device can be turned off on a regular basis. Do not have to turn it off every day. But again, a regular kind of cadence with that will be helpful to make sure that that device stays up to date and running smoothly.
And with those tabletops, make sure you use the software version of the power off, and then you can use the switch on the device. We don't want to just flip the switch, because then that can mess up some previous exams.
All right, so we've got a user referencing the Remedio camera. When they bring in closer, the screen on the phone becomes darker to black. So that can be a couple of things. That could be your positioning. Maybe we're out of alignment. Also, it could be a small pupil, right? A lot of dark shadows on that screen. And then it also could be that you're using auto capture mode. So when you're in auto capture, that brightness is going to be automatically adjusted by the device. And sometimes that adjustment can be a little jarring. So it's challenging for us to kind of say definitively what it is you're experiencing. If you're concerned that it might be an issue with the camera, you can always call our help desk. They can share the screen with you in real time and evaluate what's going on. But those are just some general ideas, that it could be happening.
Because some small pupils, when you start see the light and you start moving in, it'll get dark and then it'll get light again with small pupils.
Yep. So we've got another one. Sometimes I've got the camera lined up perfectly and I see everything, but then when I take the image, it comes out orange or white. What causes this to happen? Most frequently, it is eyelid interference. Most frequently, if you see it orange or all white, that means the person has blinked and that flash is reflecting off of their eyelid. So one thing that we like to say, we don't want to tell the patient not to blink during the exam, but if you're preparing to take the photo and you see they're blinking a lot, or you've already captured a blink, right before you're ready to take the photo, ask them to open wide. And once you see they've opened wide, then you can go ahead and take that photo. If you've got someone who's blinking a lot, you can also have them blink very deliberately. So you'll say, okay, blink, okay, open, okay, blink, okay, open, and then take that photo. Because that kind of gives them some time to close their eye and open it, but they can't usually close their eye again that quickly.
They're more focused on the blink rather than the continue blinking and fear. A lot of times I always like to warn them that, hey, there's no air puff with any of the handhelds or any of the tabletops. And that's what really a true blinker, they're literally afraid of the air puff. So just giving them that warning can sometimes alleviate some of that.
Absolutely. All right. So we've answered some questions regarding the on and off. So a couple of specific questions about things that are happening during the image capture process. Again, we're not really able to troubleshoot all of the things that are necessarily going on. If you see that the eye looks like it's going to be a good photo and then you take the photo and it's not a good photo, you can always send that to Iris, right? You can always ask us what's going on in real time, because it can be really challenging kind of after the fact for us to put a finger on what's happening. So please don't be afraid to reach out to us. Our help desk is available. We are happy to answer questions. Sometimes it can be a timing issue with the device. Maybe your iOS needs to be updated. Maybe your app needs to be updated. Maybe the shutter speed isn't fully engaging properly. Maybe they blinked. Maybe you got out of alignment. It's hard for us to gauge that, from a question kind of after the fact. So if you've got questions on how your device is operating, or if you don't feel like it's operating correctly, don't be afraid to reach out to us. We're happy to address those in real time.
And it's always good to practice on a coworker real quick. If you get something that you don't seem right, if you go practice on somebody has very nice pupils, you can make sure everything's working. This camera does, again, it has the iPhone, and these two communicate via Bluetooth, so they have to time each other. Infrared, lenses, and flash are all in this. This is actually taking the photo. So if they mistime each other, because the iPhone likes to change their shutter speed sometimes, you can get a black photo, a white photo, or a purple photo. None of those are admissible, and that may be one that may be popping up why it is an all black photo, potentially.
Yep, absolutely. Got a question regarding battery charging. Again, that's something our help desk is happy to address. I will follow up with you after this webinar and create a ticket, because if your camera's not charging, that means you can't use it. So we definitely want to get that fixed for you. The last thing I'll say with these handheld devices before we end, it's always a good idea to remember that you can pull back and reset at any time, right? So if you're coming in and things aren't looking correct, don't take the photo. Pull back, reset. I pull back and reset all the time. And what I see a lot of times with camera operators is they get up there and then they're still trying to find it. And I like to pull all the way back till I can see the eye again, right? So if Corey's my patient, if I'm up close to his eye and I suddenly lose my place, I'm going to pull back just a little bit, find his entire eye again, aim for that pupil and come in. Because all it takes is a small movement on your part, or maybe your patient's eyes moved, and then suddenly you're out of place. So don't take it as you doing anything wrong. Corey and I pull back and recenter all the time. And it's a lot easier to do that and then come back in than try to find your place or take a photo and waste a flash for something where you can't see the anatomy.
When you're doing a handheld, again, you know your target is that retina, that either the silver portion or the light purple, what we call the pearl in the remedio, that is your target. If you lose that view in your thing, you got to pause and locate it or back out till you find it again, and then you know where your center point and your target is. You don't want to lose your target. You want to constantly, you're making subtle movements, making sure that is always in your view, because if you lose it, you're going to lose the anatomy in the picture. You're not going to have it. So always keeping that in your view is highly desirable. That's what you got to do if you want to capture a picture of what you need.
Yep, absolutely. If you don't know where you are and you can't see what's going on, then it's not time to take the picture yet.
Anatomy will not be there.
Absolutely. Great questions, everyone. Thank you so much for your engagement. We are at time, so we're going to go ahead and conclude. Again, we mean it when we say you can reach out to us. We mean it when we say we want to hear from you. If you have questions, if you're concerned, if you have issues, if something's not working, we are happy to help you. Please reach out to our help desk. You can give them a call. If they're on the other line and you leave a voicemail, that voicemail generates a ticket and they will reach back out to you. You can send them an email. They're highly responsive. We always get really good feedback on them because they're really on it. So please don't hesitate to reach out to us. We are happy to help. Thank you again for being with us today. We really appreciate your time. Have a great day, everyone.